Thank you all for making the August CTIP can call. Really excited about this one and somewhat beyond what we were anticipating a month or two ago. August has been pretty busy here in DC. So really excited for all aspects of this call. But to start off with an update from Jen and some friends about uh, a lot of updates and exciting things that are coming out of DC throughout the summer, including in August. So Jen, I'll turn it over to you, and looking forward to the policy update.
Thanks, Jesse. I just put a message in the chat that I didn't mean for everyone, but it's good to be with you all. As Jesse mentioned, we've been busier than we expected this month. I have a quick presentation for you all with just some highlights from what's been happening in Washington, D.C. since we last met. So we'll talk about the Inflation Reduction Act. We'll talk about a bill to benefit veterans who may have experienced trauma, some updates from the Senate's draft budget and some wins that we've experienced there. I want to share some information about a bill to address trauma in human trafficking survivors, as well as just give some thoughts on the midterm primary elections. A lot of those are happening this month. And then I'm going to close with just an ask, a call to action from some of you on a new initiative that CTIP is trying out. And then we've invited a guest to talk a little bit more about a certain program that's being launched, and I'm not going to preview that too much now. But let me share my screen with you all. And here we are. Can we see this? Good. Awesome. Okay, so for those who may or may not have been following, President Biden yesterday signed into law the Inflation Reduction Act. You may have been following over the last year and a half, Congress and the president, Democrats, have been trying to pass a big package that they previously called the Build Back Better Act. They wanted to use the budget reconciliation process, which is a process that allows you to legislate only on spending, revenue, and the federal budget limit. So it's very specific to what you can pass, but it allows the party in the majority to bypass the 60-vote threshold for the filibuster and pass a major bill with only a simple majority. So in the Senate, that would be all 50 Democrat senators, with Vice President Harris being the tie-breaking vote. In the original Build Back Better Act, we were able to secure funding for trauma-informed community coalitions. That was a huge win that we fought really hard for. Unfortunately, in order to reach a compromise where all 50 senators could get on board for what was then now called the Inflation Reduction Act, that was stripped out of it, as well as investments in housing and a civilian climate corps and a number of other things. It's a narrower version of the bill. So our fight continues to get that dedicated funding, but certain provisions in this bill are expected to lift some of the financial burden off of our low-income families living in the trauma of poverty. And so that includes lowering drug costs. It allows Medicare to negotiate the prices, which sort of caps and limits the price of certain prescription drugs. It increases energy production, so it's expected to give us a little bit more of a buffer when it comes to energy prices and the volatility there, as well as invest in some renewables. And then it pays for it with enacting a minimum tax on the largest corporations. So those are some of the big highlights. And we can expect Democrats to talk a lot about this bill that they've worked really hard on. So that became law yesterday. Even though August is usually a total shutdown period, there's been a lot of passing legislation. And part of that is the Honoring Our PACT Act. So the Honoring Our PACT Act, for those of you who haven't been following this bill, is a bill to provide health care for and treatment to over 3.5 million veterans who have been exposed to toxins. So whether that's contaminated water at military bases, airborne hazards from burn pits, radiation from atomic testing. It's been shown that there's a link between those things and outcomes like cancer. And these veterans haven't been able to prove that their cancer is linked with this toxic exposure, but this bill changes that. So they'll be able to get the treatment they need. But notably, there is a study included that will study the relationship, the possible relationship between that toxic exposure and certain mental health conditions like depression and PTSD for veterans who have been exposed to those chemicals. So I think that's a really important study that we'll be following. I think it'll definitely have implications on the work that we do to support veterans who are impacted by trauma. And recently, the Senate has released their draft of the fiscal year 2023 spending bill. The House released theirs a couple of months ago, and now the Senate has followed. And a number of the asks that we made were funded in these bills, which is very exciting. For example, the Interagency Task Force on Trauma-Informed Care. This is the task force that is coming up with best practices and recommendations in the fields related to trauma-informed care. CTIPP was able to get first-time funding of $1 million for this task force last year. And this year we are pushing for 8.3. In the House version, they tripled last year's funding. In the Senate version, they doubled that. We're going to keep pushing for that 8.3 number, but it's good to see that the funding is continuing and increasing in both of these drafts. You also joined us in making an ask for $1 billion for school-based mental health professionals to close that gap between the ratios of students to counselors who are trained in mental health to a ratio that's more appropriate. And also to include language that encourages those school-based mental health professionals to transform the whole school to being more of a trauma-informed system. So we were successful in both of the House and the Senate of securing that $1 billion. That's no small pot of money. So that is a huge thanks to all of you for calling in and joining our letters and supporting that. We're really encouraged to see that. And then of course, the CDC, their research on adverse childhood experiences. Last year, we were able to get 7 million. This year, we upped that to request to 15 million, and the Senate matched us there. So that's really exciting to get that full funding of our request. And we will, again, make sure that that final version includes that as well. And then I also wanted to provide folks with an update because CTIPP recently endorsed the Impact Human Trafficking Act. It was introduced a couple months ago, and then it recently passed the Senate Committee of Jurisdiction unanimously. The bill does two things. It makes two temporary programs permanent. One is a program called the Homeland Security Investigations Victim Assistance Program. So victim assistance and these HSI folks interact directly with people who are coming out and surviving human trafficking, whether that's through labor or sex trafficking or child trafficking or otherwise. And through this program, they have designated coaches, designated personnel who provide one-on-one support to the survivor. So that's really flexible. They will help them find employment. They will provide them with psychological care and just support and healing, take them to appointments, help them find housing. So this bill would make that permanent. And then on the second portion, it would make permanent the Impact program, which addresses the vicarious stress in those service providers. So those folks who are meeting with and helping the victims of human trafficking are experiencing vicarious and secondhand trauma themselves. And so this makes permanent a program that will provide ongoing training to those employees experiencing that trauma that helps them to understand the trauma they're experiencing, to process the trauma they're experiencing, and provide them with support as they move forward so we can prevent burnout and just help these folks to live to be able to provide that really high quality care to survivors. So that's obviously crossed the first hurdle of passing out of the Senate committee. So we're going to do what we can to help make this bill law, because it's really important to the well-being of the federal government's ability to support those survivors of human trafficking. Second to last item on my agenda, I just wanted to mention that August is usually quiet in DC because all the politicians are back in their districts and in their states campaigning for the primaries. We have several remaining primaries in states for the rest of August and September. Florida, New York, Massachusetts, Delaware, New Hampshire, and Rhode Island still have to have their primaries. This season is a little different because we just had the 2020 census and there was a lot of redistricting. Congressional districts have changed, which make them sometimes more competitive. Sometimes two incumbents now have to compete against each other because their districts were combined. But regardless, it's a really intense time for campaigns. And so a couple of issues that are really big during this time are, where elected officials stand on the January 6th attack. So for example, Congresswoman Liz Cheney, who is the Republican co-chair of the Select Committee to investigate the January 6th attack, she lost her primary election because her constituents wanted to support someone who felt differently about the January 6th attack. So we're seeing that be really relevant in primaries. And then just some tips for you all during these campaign seasons, which extends really from now until November. Your representatives are going to be increasing the number of events in their districts. They're going to be more accessible than ever to hear from you. And so we encourage you to go to those events and ask your representative or your candidates where they stand on issues of trauma. For example, what are you doing or what do you plan to do to address ACEs? And we wanted to point you to, on our website, we have some really helpful infographics that you can print out, hand out, or just keep on your person so that you have those stats to be able to lift during those conversations. And we have those in the resource section of our new website, but a couple of them are on the screen here. So just encourage you to get involved and just start to campaign yourselves around where they stand. It's a really important time to start to lay the groundwork to hold our elected officials accountable. And then finally, we really want at CTIPP, we want to get a sense of which government grants folks in our network are receiving. And that will help us to inform our advocacy to make sure that we are advocating for as much funding as possible in the pots that people in our network are eligible for and receiving. We also, it can lead to, if there are a lot of folks in our network who receive SAMHSA grants, we could do programming to help people present strong applications to SAMHSA and invite one of SAMHSA's grant folks out to present. So this could be really, really useful information to us. And what we really want to do is circulate this form, have folks fill it out so we can understand what federal grants, what state and local grants you are getting, so we can make sure that we are advocating for the increase of those grants, and also making sure that when you apply for a second or third time, we're able to help you to amplify your request. So we haven't publicized the form yet, but what I'm asking in order to help me finish the form, I just want to make sure that the questions we're asking are really relevant, that we're collecting all the information. So if anyone on this call, your organization does receive government funds, if you can just email me at the email on the screen, I'll also put it in the chat. Love to connect with you to just get a sense from you. And then we can finalize that form and circulate it. And that will help inform our process for the next appropriation season and additional programming that might be helpful. So that concludes my presentation. Of course, will be available online as well afterwards. And I am right on time. I'm going to next introduce Brett Beckerson, who is here from the National Council on Mental Wellbeing to present on certified community behavioral health clinics. As we mentioned last month, the president recently signed a legislation that would address gun laws, and it included a number of provisions around mental well-being and mental health. And the National Council on Mental Wellbeing played a really significant role in securing additional funding for community-based trauma-informed services. And that money will start rolling out to communities soon. And some of it already has started rolling out. So we wanted to invite Brett over to just talk a little bit more about those programs, those clinics, the work that the council is doing. And you'll have time after his presentation to ask questions. So definitely start thinking about that and mulling those over. So Brett, I will pass it over to you.
Great, thanks so much. I shared my screen and I'm going to put my email address in the chat. So unfortunately, I have a hard stop at 2:30. So I'm going to try to do this as much as I can. I got a lot of content here, but feel free to email me any questions that you all have. Happy to go through it. So first, want to kind of define what a CCBHC is. So a certified community behavioral health clinic is a provider type that exists at the local level that is run by states primarily. And so their goal is to make sure that they're providing integrated, evidence-based, trauma-informed care for anyone that has a mental health or substance use condition, right? And they're required to provide those services to all ages, and they are required also to ensure a health equity approach, both in how they're staffing as well as how they're delivering care. So when you look at what a CCBHC is across the country, so right now we have about 450. And so these 450 are providers at a local level, right? So you may have a community mental health clinic where you live. It may be part of your county government. It may be a regional provider. So this is somewhere that provides outpatient care for anyone who has a mental health or substance use care need. Now, prior to the establishment of CCBHCs, which initially launched in 2017 after Congress established the model, there was no definition for what an integrated service model looked like or what integrated care was. So you would go to one place if you had a substance use condition, you'd go to somewhere else if you had a mental health condition. Neither of those places could treat anything related to your primary care needs. So clients had to pop from one place to another. If you were a parent, you had to take your kid to one place and then you had to receive services somewhere else. So this provides an opportunity for really a one-stop shop and creates that standard definition. There's also quality reporting metrics. It may not surprise you all, but there was no quality metrics for outpatient mental health and substance use care that were required by states for those providers. So this creates a uniform definition so you can have those standard apples to apples comparisons for quality metrics for CCBHCs. And all of it's provided by a payment rate. So there are clinics that get a seed grant funding. The vast majority of this 450 receive $4 million at the local level to establish the CCBHC, to convert what they're doing to the CCBHC model. But by and large, the goal is to convert them to a payment rate, which is similar to what we see with other models like a federally qualified health center, where it fully covers the anticipated costs of delivering equitable care for anyone with a mental health or a substance use challenge. So on the map, you'll see there's 450, and the vast majority of the country is orange. So ones that are just a solid orange have at least one grantee at the local level. Ones that have a white or yellow line through them are part of the national demonstration. And ones that have a gray line through them are ones that chose to move forward independently. So when Congress passed the Bipartisan Safer Communities Act, what this allows every state in the country to do is to be a part of the demonstration and to have this within their Medicaid program. I'm going to get into some of the data here in a minute about kind of what this actually means. But within the actual criteria of the demonstration, there are 6 different criteria points. In a previous conversation I'd had with Jen and some of their colleagues, I focused on children and youth, and I thought that would be relevant here as well, looking at as a focus around trauma-informed care. So within every single component of the CCBHC model, there is an element for children, youth, and families. There is a component around trauma-informed care, and there is a key element around equity as well. So from staffing, when those services are available, looking at care coordination, what the scopes of services are, and to even who can provide those types of services. We want to ensure that no one is lost in the shuffle and that we're able to meet all the needs of the community. From a data perspective, 2 states that were able to launch the model in 2017, New York and Missouri, they saw that they were able to provide care for, again, looking at this from a children's and youth perspective, 1 out of 4 clients being under 24 years old, and they were able to increase care by 24% for children and adolescents. What's really kind of powerful about this is that once the kids were in care, the parents and grandparents were in care, kind of breaking those cycles of untreated mental health and substance use. But what the model allows, which is unlike any other model within Medicaid, is that you're able to embed clinicians into non-clinical environments. So if you are working with child protective services or the broader child welfare system, into the court system, juvenile system, or other systems, right, when we're looking at criminal and civil justice, and you're able to embed clinicians into schools. So oftentimes at a school-based level, you may have some tug of war to say, well, we're trying to hire social workers in one space, but they're also trying to hire them within the school. And as a social worker, who wouldn't want to have, their summers free and only work within a particular period of time? So you lose a lot of talent to school systems. So this creates a marriage between outpatient clinical settings and schools to make sure that everyone can receive a screening assessment, be able to intervene, provide evidence-based services, and connect those folks to care where they can either receive medications for their conditions or outpatient psychotherapy. In Missouri, they embedded their clinicians within the entire child welfare system and within their school systems, and they saw a $3 million decrease in expenditures yearly within their Medicaid for kids, and then looking at a $1.8 million decrease, again, yearly from their foster care system. So huge reduction in overall costs because they're able to integrate that care system. But beyond just the child welfare system and those costs, other states, so Oklahoma set up the model through the CCBHC demonstration. Texas did it independently. And so you can see here some of the ROI that they have around jobs, some of the ROI they have around savings. And one of the big things that you hear a lot within the mental health and substance use space is that we need more beds, we need people to go, have that place to go. Oftentimes, the reason why there is a need for beds is because that person is housing insecure or homeless. But also because that individual may be in such great a need of care that a kind of crisis stabilization moment's necessary, but inpatient residential care may not be necessary. So the CCBHC can also embed staff within those other inpatient and residential environments to make sure they're connecting and deflecting folks to an appropriate setting. And that can also happen within emergency departments too. And when we see a big ROI from some of the work that they're doing in Texas. Across the country for the impact of CCBHCs, we see a lot of opportunity too. So one thing was that within a 1-year period with the CCBHC model, they saw an increase of around 1.5 million people served nationwide. From that child and youth perspective, able to hire psychiatrists, youth psychiatrists. And so again, if you're looking at the kind of end salary and kind of work-life balance for someone, it's hard to get clinicians to work with Medicaid populations because the payment rates are not great. So with CCBHC is you're able to ensure that you are hiring folks at a rate at which they can maintain their standard of living as if they were working within the private sector. So able to recruit folks over, give them that quality of work and that work-life balance, but also meeting the needs. So you can do that through the model because the payment rate reflects the actual cost of care. And then when we're looking at medications for substance use disorder, specifically opioid use disorder, we're seeing that CCBHCs are substantially increasing access to those to folks with those conditions as well. And that was my very quick kind of rundown. I'm sure I've not provided all the necessary answers that you guys might be looking for, but I want to answer some of the questions that are also in the chat and then be able to provide a bit more context for the next 5 minutes or so.
Thanks so
Okay.
much. Jen,
Thank
go
you.
ahead.
Yeah, so it sounds like we had one question that was from Jeffrey Gordon. Are CCBHCs funded through Medicaid? If so, at the state or federal level, question mark, or separately? What is the range of providers who actually provide mental health therapy?
So CCBHCs, it is a Medicaid program. So there are CCBHCs that receive SAMHSA grants. They receive $4 million for a 4-year period. It previously was a 2-year period. So it was a grant-funded program, but those grant-funded programs went to Medicaid providers. So this was meant to fill in any gaps in care delivery where a fee-for-service structure within Medicaid wasn't cutting the mustard. So they could be able to hire folks and do those services. It is, though, a Medicaid program. And so it is a state-run program, different from what you see with FQHCs or federally qualified health centers, where although they may be functioning within a state, they are federally qualified, so back in DC. So it gives the state a lot of governance over what that looks like. So the clinics can assess the model, the state certify them, and then they're able to deliver that care. And there's a full range of mental health therapies that are provided. We can send you a full list of what that looks like. But in reality, what's reflected there is that if they conduct a needs assessment and they see a high level of need for, let's say, something like zero suicide, or let's say trauma-informed recovery-oriented efforts, or a higher need for psychotherapy or dialectical behavioral therapy or things like that, they can then hire staff who have those trainings.
Thank you. I see another question that is asking if there's been any CCBHC integration with prisoner services.
Yes. So I will find this report and I will put it in there. It's a report that I wrote. So CCBHCs actually embed themselves within the entire sequential intercept model. So from deflection diversion, and they absorb that cost. So whether it is embedding clinical staff like a social worker or embedding technology, they will be able to do those kinds of deflection diversion on the front end. They can also embed themselves within a court system or within the jail to do a screening and assessment, so that if someone screens positive for a mental health or substance use condition, they can then advise the justice system that holding them within that facility, positive for mental health or substance, and then negative for criminogenic risk. They can then make that advising to keep that person in their home, to have those outpatient care provided, and then message appropriately to the public defender or to the district attorney about what might be necessary. So when we're looking at within the jails, they can then create a marriage with that provider within that justice, within the jail. So usually jails outsource their healthcare, and so they can do that kind of financial relationship there.
Thank you. And I think we have 1 minute left. So one more question. Are CCBHCs required to facilitate peer support groups? If so, are they partnering with schools or family resource centers to do so?
So peer support is a requirement of the model. It's a requirement in its scope of services, and it's a requirement within the staffing structure of the model. So they are required to have peers. They're required to have peers, and those peers must be paid at a value that reflects the quality and expertise that they are providing. So if you have peers working in spaces that are maybe non-clinical, right? Let's say, maybe they're at a restaurant, maybe they work at a corporate firm or what have you, they're then able to be provided a salary commensurate with the need that's there to usher folks into care, destigmatize care. So it is a requirement there of the model. We also have data from our impact report, and I'll share that as well, of the number of peers that have been increased. So between peers and psychiatrists, that's been the standard, or been on average the highest level of provider type that's been hired. There was also a question in the chat, and I want to make sure I can address it, about where those dollars are being used. So moving forward, so initially there's 10 states a part of the demonstration in 2017. So that's Medicaid funds to establish the model in states. What the Bipartisan Safer Communities Act does is every 2 years, beginning in 2024, 2026, 2028, 10 more states are invited to become part of that demonstration. So that provides an opportunity for Medicaid to cover things that it doesn't cover usually. So trauma-informed care, care coordination, integrated services, quality tracking, hiring technology, telehealth. So a number of things that your state may not cover currently. Through this demonstration, it allows that coverage and in an effort to meet those needs of the community. So if you are in a state where you're like, this could really be helpful, or I at least want to make sure it's on the state's radar, advocate that your state apply for the demonstration. The application will be open this fall, sometime between October 1st and December 31st. And when that happens, that provides that state the opportunity to establish this model and have Medicaid be reimbursable at the local level and include those services that are relevant and necessary based off of the community's needs. So it's about $9 billion that will be invested over the next 14 years. So we want to make sure that folks who want their state to be engaged heavily advocate at the state level that they apply for it. So that way folks aren't missing out and have CCBHC FOMO.
Love it. Thank you so much, Brett. I know you have to run, but I'm so glad you ended with that call to action. We'll definitely make sure that our advocates have the tools they need to lean in when the grant applications open, so as many states as possible can take advantage of this. But thank you so much for your presentation. We can let you go. And I know there are, just for other folks, I know there are some unanswered questions in the chat, but Brett put his email in the chat again. And so if your questions remain, he asked that you send them his way so we don't hold him up too much.
No worries. Happy to help everyone. Thanks so much.
Thank you, Brett. Awesome. All right. Well, Jesse, I will turn it back over to you. That concludes our policy updates.
Thanks so much, Jen. And I will go ahead and turn it back over to you for one additional question that was in the chat during your presentation, which I think is just a really good opportunity to sort of amplify how Ctip and our advocates are making a difference in the policy sphere. But the question from our good friend Denny was, can you actually demonstrate that Ctip's efforts influence the passing of the legislation? I think that this was with regard specifically to the appropes ask that we had. And the direct quote was, our efforts paid off. It would just be so huge if we were able to demonstrate that. So question there, and maybe a good call to action to help wrap up, again, the policy section of this CTIPP can call.
Definitely. So usually when I'm preparing a presentation, I am very thoughtful about how I want to present information so I don't get too in the weeds, but you've put me on the spot. So I'll do my best. With the appropriations process, there's so many different grant programs that need to be funded. And usually the majority party, with some input from the minority party, gets to decide on the appropriations committees, gets to decide what level of fundings each of those will be at. And they're influenced by what the president and what the agencies want. So the president releases his request. The agencies put out their requests. We want to fund the ACEs research at $8 million this year. The president says, I agree, $8 million. Well, then if we really think, there's just such a high need, especially with the COVID-19 pandemic, we really think $15 million is more appropriate here. It will allow them to do X, Y, and Z. What we want to do is get members of Congress engaged in amplifying that request to the Appropriations Committee, because that's such an important voice here. So you have the president, you have the agency, then you have members of Congress on the Appropriations Committee, off the Appropriations Committee, and then of course you have voices from national organizations like CTIPP. And so for the example of the trauma-informed schools request of $1 billion, we partnered with a number of members of Congress, and they wrote a letter to the Appropriations Committee saying, we want to fund this request at $1 billion. And what we did, for those of you who are on the call, I think it was in April, was we did a call to action together where we took 10 minutes and everybody on here called their member of Congress and ask them to sign on to this letter to support this appropriations request. And a similar letter for this pot of money was sent last year, but through CTIP's voice being engaged in this pot of money, we were able to increase the number of members of Congress who signed on to that letter by about 25%. And so the committee is very influenced by, how many members of Congress are supporting this request on the Hill, stakeholders off the Hill. And so adding our voice to that process by calling in, by, myself having conversations with the Appropriations Committee, with staff, with offices, to really increase that support in a number of different areas. That really pays off because they'll listen to that pressure. If we don't apply that pressure, as a group, they may be sort of, sit at a lower number. And so I think when we look forward from here, the House and the Senate, they just released their drafts. Now they have to pass them through each chamber. And then the bills will be conferenced so that the House and the Senate will try and arrive at a compromise of one package with funding levels that can pass both chambers and be signed into law. Our next step here is for the numbers that are lower in the House than in the Senate, or they just don't meet what we wanted, we're going to continue to advocate to the conference committee to say, please keep this number or please increase this number in your final bill. And that's another opportunity that we'll ask you all to be engaged in making sure we are applying that pressure and elevating that advocacy. So that's the best I could do at a short answer to that question. But when I say our work paid off, I think it's really about being artful and strategic about when we apply pressure and in what ways and how we are mobilizing around certain requests.
Thanks so much, Jen. Really, really appreciate that. And just putting in the chat for everyone, in case you haven't seen it, Jen every month provides a DC update that they write as well. And that's posted on the CTIP blog as well as on Pace's Connection. So that's an overview of everything that was just presented on, sans, I think, the CCBHC part. And so that's something that you can read again, share with your friends, as well as the recording for all of our CAN calls are obviously made available as well. We are about halfway through the call, and we're going to move into the second half of the work here, or of the call, and really highlight press on again, because we knew that August is usually a little bit of a lighter call. We wanted to highlight some of the vision that went into press on, really highlight a lot of the history that led to it from, especially from Dan. I'll get to chime in a little bit here, but really highlight the work and why the coalition building that we're focused on, as well as the policy and advocacy work, and they come together in many ways, which we'll highlight, is so important to CTIP's mission and vision. Before we get there, as we did during the workshop series, just recognizing that sitting in front of a computer or phone can be, a little bit tiresome throughout the day. We've started to implement some brain breaks, and just want to do a quick one. We'll do 3 rounds of breath with my personal favorite brain break. This one's really nice for me because it's something that you can do very easily as you continue to work, right? The scissor winks, which is a very fun one, looks a little bit goofy on a call when your camera's on, at least. Still encourage folks to do it if they want to. But my personal brain break and sort of regulating activity during work is what I call wave breaths. And so I'll breathe along the crests and troughs of a wave. And imagine my breath sort of slowing down at the top and at the bottom. So if we just want to do 3 quick sets of that as a centering activity before we get into the second half of the call, that would be great. So you can sit however you're most comfortable, lay down, stand up. It's up to you. And again, we'll sort of breathe in through the trough. I forget what crest and trough, but we'll breathe in as we go up, sort of slow it down and slowly anchor ourselves back into an exhale, and do the same on the inhale, right? So it's just a regulating breathing activity. So we can inhale on the way up and then sort of slow down, and then exhale on the way down, and then slow down again and inhale, and slow down and come down on an exhale, and really feel your belly expanding on this last one where we inhale, slow down, and we exhale. And again, that's something that you can continue to do throughout this call, throughout the rest of the day. I personally find that it is also fantastic for yoga when I'm in downward dog and my shoulders are on fire. And so whenever that can be of use, hope that that's a decent brain break. But without any more hesitation, I want to turn it over to my good friend, mentor, inspiration, Dan Press, to sort of share a lot of his history, which is where we're going to start with this portion of the presentation. So Dan, I turn it over to you.
Thank you, Jesse. Just so you know, I just got out of the hospital with a lung infection that was on top of a broken vertebrae. So I'm not going to go on video. I look like a patient. So, and I hope I can make it through the presentation. Thank you, Jess. But my presentation really was framed by the question Denny just asked and that Jen answered, which is, what does it take to be effective with Congress? And the bottom line is it takes two things. And this is what I've learned over 50 years of working with Congress, and I'll get into as an attorney for Indian tribes. It takes somebody like Jen who walks the halls of Congress and educates staffers about the importance of the trauma work we're doing. The second piece that's needed is a local piece, that Congress people ultimately pay attention to their voters, and it's the pressure from the local level that really makes the difference. So Jen is a critical piece of the team, but she won't be as effective as she could be if there's not a local pressure coming from local trauma-informed coalitions. And just to start with my history, Jesse asked me to give my history. I'm got 50 years of it. I'll see if I can try and summarize it. But I got out of law school in 1968. I went to work on the Navajo reservation as a legal services attorney. And we would sit there day in, day out. People would come in with a whole range of problems. We were the first attorneys the Navajo ever had an opportunity to use for their personal needs. So they were being cheated by car dealers and traders and weren't being given their Social Security. But as I began handling these cases, I came to the conclusion that the single most important issue I could make a difference on was employment. I felt that if people had jobs and unemployment rates were like 60, 70%, that there wouldn't be as much substance abuse. There wouldn't be as much personal family abuse, that kids would come home and they'd see their parents returning from work and it would serve as a role model for them. So I devoted a good portion of my time to try to improve the employment situation. And in particular, I learned there were lots of laws and leases and contracts that had an Indian preference provision in it that required the employer to give preference to Indians in contracting and employment. And they were being ignored. There was no enforcement mechanism. And the contractors, particularly the ones building the schools for the roads, the houses for the Indian community, weren't hiring Indian people. So we went to war on that issue and won a couple of big battles, one at a big power plant that had 1,000 employees. When we started, there were only 10 Navajos, and when we were finished, there were 500 Navajo employees. And out of that, we worked with the tribe to create an Office of Navajo Labor Relations, whose full-time responsibility was to enforce the Indian preference provision, required employers to provide data, required employers to show they, I'm sorry, showing that they tried to find a Navajo employee before they hired a non-Navajo, set goals and timetables. And after I helped the tribe do that, I moved to Washington, D.C. And it was a hard move. I had to give up my horse, but I had become a cowboy while I was out there. Fortunately, I was able to go back every couple of months and visit my horse and help my friends round up their cattle. But I moved to Washington, and as part of a consulting firm, we approached the Equal Employment Opportunity Commission for funding to help other tribes set up what we ended up calling them Tribal Employment Rights Offices, or TEROs. And starting with 10 tribes in 1977, we grew 10 more the next year and 10 more the next year, providing them with legal advice and with hands-on technical assistance on how to create an office. And today, over 300 tribes have TERO offices, including Alaska Native villages. The program just celebrated its 45th anniversary. It was a fight. There were so many forces out there who were opposing us. The unions and the contractors and the federal agencies didn't like tribes exercising their sovereignty. And the key to the TERO is tribal sovereignty. The tribe has the sovereign authority to direct entities on their reservations how to hire. And it was a very productive use of tribal sovereignty. And after fighting battles for about 10 years, it finally became established. And as I said, it's now in its 45th year. And my hope, my vision, my belief was that in not too long a time, there'll be thousands of Indian construction workers, journeymen, thousands of Indian contractors and subcontractors, and that 99% of all of the work on reservations, at least in the construction area, would be done by Indian workers and Indian contractors. As I'll get into in a little bit, that turned out not to be the case. I then spent the next 35, 40 years on a whole range of economic development projects for Indians, helping to create the Native American Bank, which does the largest amount of BIA loan guarantees of any bank in the country. We help tribes become eligible for the SBA 8A program, which allows them to get sole source contracts. And these days, tribal and Alaska Native companies are being awarded billions of dollars of sole source contracts. And I spent a lot of time working with Congress on a whole range of legislation, grant programs and funding programs, lobbying for the appropriations the way Jen does. And we seem to be making progress. And then in around 2008, 2009, something caused me to stop and take a look. And I said, you know, the changes, the progress I was assuming was going to happen isn't happening. There still aren't that many Indian construction workers, and a large percentage of the employees on these projects still are not Indian. There are very few Indian construction companies. And then I did some additional digging and saw that some of the other really key issues hadn't improved. Native Americans still had the highest suicide rate in the country, the highest substance abuse rate in the country, the worst performance in schools. So despite tribal governments really becoming much more sophisticated over the 40-year period, excuse me, besides a lot more Native Americans going to school, graduate school, law school, medical school, the fundamental problems on the reservation hadn't changed. And it puzzled me, and I couldn't figure it out. I said, something is in the way here. And then I was given an opportunity to teach undergraduate courses on Native American government at Columbia University, my alma mater. And I entitled the first course is what is the barrier that is keeping progress in occurring? And I had 20 of the smartest kids I could ever ask for in the class. And we went through all the options. Is it the Bureau of Indian Affairs is an obstacle? Is it the fact that Indian land is held in trust by non-Indians, by the federal government? And we went through it all. And at the end of the semester, there was consensus. There's only one explanation, and that's historical trauma. And fortunately, Columbia had some professors in the psychology department who were doing really groundbreaking work on historical trauma using mice to do experiments. So we brought them in and they talked about it. And at the end of the semester, I think it was clear to all of us that the reason, the barrier that I had been so puzzled about back a few years before that was was historical trauma. So then what do you do about it? Right about that same time, I got to hired as an attorney for a woman named Dr. Tammy Dakota, a Native American psychologist who was doing trauma-informed work on the Standing Rock Sioux Reservation. And her work was so innovative that it got the attention of her senators. And they asked her to come in and testify. And that immediately made all her colleagues at the Indian Health Service jealous. And so they went out to get her and they undermined her. She was the only psychologist on the reservation. They put her in a room without a computer, without a phone, and told her just to sit there. Well, she quit. We sued the Indian Health Service for constructive termination. And it turned out every reason they gave for firing her or disciplining her turned out to be wrong. We had documentation showing they were lying through their teeth. So we settled the case. She got back pay. I got attorney's fee. She got a record cleared. And then Tabby and I went to work trying to, what do we do next? How do we get trauma-informed concepts established in Indian country? And one day, Tabby called me and said, I never mentioned this to you, but I used to babysit for Senator Heitkamp, who was then the senator from North Dakota. And she just called me and said she wants to have coffee with me to get my thoughts on what she could do to help solve problems in Indian country. We talked about it and said, let's have a roundtable on trauma, on historical trauma. So Heitkamp agreed to do it. We had a roundtable in the Senate office building, and we had people from the BIA and the Indian Health Service, Indian Department of Education. And then we had people from several tribes, including the Menominee tribe, which had implemented a comprehensive trauma-informed program on its reservation. The schools were trauma-informed, the healthcare program. And that became, we heard that, and that said, there's the model. That's what we need to do. So we created a national organization called the Roundtable on Native American Trauma-Informed Initiatives, with the goal of trying to persuade tribes to replicate the Menominee program. The roundtable was wonderful. Senator Heitkamp walked out of there. She said, I've been to so many meetings and hearings in this building, and I always walk out depressed. This is the first time I'm walking out feeling encouraged that there is a solution out there. And Senator Heitkamp became an advocate on the Hill for trauma-informed programs. And she enlisted Senator Durbin, and they began working on legislation to promote trauma-informed programs. And on behalf of the Roundtable organization, I got involved helping to lobby for the legislation they were pushing through. And they were able to get a couple of provisions in the big opioid bill, the Support Act, but we couldn't get people to really address the fact that if you want to address opioid addiction, you need to address trauma. The bill was almost totally on treatment and not on prevention. It was frustrating. And I spent the next couple of years walking the Hill trying to persuade Senate staffers that how powerful the science is. And they listened, but I realized that what was missing was the grassroots campaign, that so that these staffers were hearing from their constituents that they wanted something done about trauma. And that's where Jesse comes in to talk a little bit about the national campaign. Jesse?
All right, Dan. We'll give you a breather. So before I get into the campaign, I just want to share two things really quickly based off of what Dan shared. We didn't do a PowerPoint because we wanted for this to be more of an organic conversation, but I do want to share this one photo of Dan and his horse for those who are interested, and a dog, which don't know the story about that, but just to show you, Dan, that's from Window Rock. And then the other piece that I want to share that Dan and his law firm Van Ness Feldman published back in 2019 is this handbook that Dan helped to write on behalf of the Roundtable on Native American Trauma Informed Initiatives. If it's a helpful resource, it is a very comprehensive and organic document. See some questions in the chat that we will get to later. But like Dan said, I was very fortunate to come into this picture at the time that Dan was starting to think about how are we launching this campaign as CTIP was forming. And a quick story about how Dan and I met. I was an intern at the Attorney General's office in Pennsylvania, tasked with helping to develop the Pennsylvania Trauma Informed Care Network, which has influenced the development of HEAL PA. It's a different initiative in a different office, but the work in the AG's office helped support the development of the Office of Advocacy and Reform and work in the governor's office in Pennsylvania. And during that time, it was actually my 24th birthday, the day of my 24th birthday, the final day of the MARC conference, which was in Philadelphia, my home town. And Dan was given a presentation about like trauma-informed policy, essentially. I was fortunate enough to be brought by Sandy Bloom. And so I was, following Sandy essentially like a puppy on a leash, without the leash, but following her very, very closely the whole day. After the presentation, we went to Dan's presentation, and Sandy went up, introduced us, and Dan and Sandy were talking about CTIP and whatever else. Dan has no recollection of meeting me that day, and I will never forget it because I remember that at that age, at 24, the day that I turned 24, I was like, I want to be something like this guy when I grow up. That's what I want to do. And so, it's been a real privilege and pleasure to get to learn alongside him and work with him over the last 4+ years now, and to continue to moving forward. So just wanted to share that. But like Dan said, we recognized that there needed to be a campaign of sorts that really activated the grassroots network, right? It wasn't enough for just Jen to walk around Congress, which Jen can talk about their perspective on why it's so critical to have advocates in every district. It wasn't enough to just have Dan communicating with members of Congress. It is critical to have advocates in all 435 legislative districts. And I had a really nice perspective because I was the director of development at a community center in Philadelphia, trying to launch a trauma-informed initiative. We called it the LOVE Initiative. It was lowering overdose and violence epidemics, is what LOVE stood for, very Philly-centric in terms of the acronym. But we were trying to do this without any funding, and we're really struggling to pull it all together despite having a backbone organization in the community center. And so I recognize the struggle of creating a trauma-informed initiative at the community level while also having a platform through CTIP to be able to advocate at the federal level. And taking a step back in my personal life, I've talked to Dan about this, but at the time when I was younger, when I met him, I was struggling with substance use, I was struggling with depression, and there were different things that I needed to heal. And I can say that the advocacy angle, in addition to supporting what I was doing at the community center, but also being able to bring my lived experience into the advocacy and talk about why systems change was so necessary to promote better outcomes at the individual, family, community, and social level as a whole, has been healing for me and was healing for me. We have an advocacy series on our website, but being able to formulate my story and put it into a perspective that allowed for transformation to happen, and for me to see how past pain could have a purpose to reduce the pain of others in the future and in our society, has been a healing process, and we want to bring that into CTIP. But back onto the campaign perspective, before COVID, so around July of 2019.
Jesse, could I interrupt for?
Absolutely, Dan. This is your
before. Yeah.
More
I realized I didn't tell everybody how CTIP got created. So you're already. So
My bad.
yeah. So one of the people on the roundtable, a researcher at NIH, was asked to speak at this program that Dr. Andy Blanche had put on of federal employees on trauma. And so I went to the lecture, and at the end of the lecture, I walked up to the front of the room to talk to my friend from NIH, and she introduced me to these two people, Andy Blanche and Sandra Bloom. And we told them about how we had created this roundtable on Native American trauma-informed programs. And Sandy said, you know, we've been talking about creating a national trauma-informed organization. I said, well, why haven't you? You need one. And she said, well, we don't have a room in which to meet. So I said, I've got a law firm that has lots of conference rooms. Come have a meeting in my conference room. And a couple of months later, we had 25 people, led by Sandy Bloom. And they created CTIP. And then we, as I love to tell people, I found a stray along the streets by the name of Jesse Kohler, who really helped take the organization to the next level. So that's how CTIP got started. Go ahead, Jess.
Thanks, Dan. That's pretty indicative of our conversations where he'll pull us back on track. But so, in July of 2019, Dan and a few others, Whitney Maris is on the call. There was also Marlo Nash and Jeff Hild in the original meeting. And then I joined the second meeting along with Erin Connolly, and others have joined the core team since. But there was a recognition that there needed to be a grassroots movement, and that there needed to be advocates in every legislative district that were connecting with their congressional representatives as well. And so we brought, we started to formulate with very regular meetings as a volunteer group, sort of CTIP as a backbone organization for it, develop what became the National Trauma Campaign and create an infrastructure in which advocates were able to join, a national movement, have talking points and email templates and understand policy, sort of have a platform in which all of that was able to be delivered, which outside of CTIP CAN became one of CTIP's primary activities at the time. And we launched in February of 2020, which was just not a great time for anything to launch. And so we quickly shifted the campaign's focus in the last Congress around trying to direct stimulus funds, as you all well know. But through that process, and based on Dan's experience that he shared, my experience, in trying to develop a local community coalition, we also recognize that while the National Trauma Campaign is so important, and for those of you who have not signed up yet, I will put a link into the chat where folks are able to sign up when I'm done speaking here. But we recognize that there also had to be more support for coalition development. We heard from a lot of advocates that they felt alone in their advocacy journeys. We recognize that while we promote and advocate for policy, there also have to be coalitions that are doing the work in the grassroots, and that we are driving systems change through organic spread in communities created by cross-sector, diverse groups that are informed by people with lived experience and share responsibility across the community. That's how healing is going to take place in this country. And so we came up with a new initiative to complement the National Trauma Campaign, and the National Trauma Campaign is still going strong. You heard all of Jen's policy updates earlier, and we continue to do tremendous advocacy on that front. But in connection with PACE's connection, the National Prevention Science Coalition to Improve Lives, and other partners, we created an infrastructure for coalitions to be able to join at the local, the community coalitions, regional coalitions, statewide coalitions, and developing this national coalition of coalitions to continue to promote trauma-informed work at all levels, both reaching up to policymakers, other key decision makers, to influence legislation resources flowing to trauma-informed coalitions and work in communities, as well as doing that reach down and really building relationships in communities, changing and transforming the way that systems within communities work, and reimagining how systems inform and influence the work within communities. And so I will turn it back over to Dan to talk a little bit more deeply about Press On, and I will put links in the chat for both the National Trauma Campaign, for those that have not signed up yet, as well as for Press On, to be able to join those.
Thanks, Jesse. To answer someone's question, my horse's name was Buddha. I did not name him. He came that way, but it really is fortuitous. It was a great horse, smart. But if you walk the halls of Congress almost any day of the year when Congress is in session, you'll find it full of people from the local level, little groups, all with their badges on, or they're handing out material advocating for their particular cause. Everybody's got a great cause, and those who are most effective in getting money and legislation from Congress are the ones that have been able to put together a united effort from the local level, so that the congressmen and senators know that this is an issue that's important to their constituents. My vision is one of these days, and I know it's Jesse's, is that we'll have a Hill Day, and we're going to have hundreds of trauma-informed coalitions from all over the country walking the halls of Congress, meeting with the senators and Congress people, educating them about trauma science, educating them on why it's so important for federal dollars to be allocated for local coalitions. And for that to happen, we created the Press On, which is a national coalition of local trauma-informed coalitions. We need every one of you that's a part of a coalition to sign up, make your coalition part of this national coalition. Those of you who aren't in a coalition, we urge you to get together with other people in your community and create a coalition. Because while it's great to have individuals lobbying, the most effective way is for an institution in that community to be the one speaking with a voice to your senators and congressmen. So that's where I want to see Ctip go for the future, to build this national coalition that is a powerful voice, that is heard all through the halls of Congress, and that we finally get what we know is needed, like funding for local coalitions, federal programs being required to incorporate trauma-informed science into their health or education or labor programs. There's so much that needs to be done, and it can only be done through this grassroots effort to educate and advocate with your elected officials. So we're going to be launching this thing in the national coalition in a couple of weeks, I guess. And we also created a coalition of statewide coordinators to have a similar coalition of statewide coordinators. And thank you, Carrie. Remind me to if you create a coalition, create a community on PACES. So I think my voice is running out. Jesse, I'll turn it over to you. But thank you all for listening. Thank you all for your really caring comments. I really appreciate it. I'm gonna work to get better.
We love you, Dan.
Thank you.
We really do. You know, we were excited to also get, you know, all of your vision and your thoughts into this. You know, the last thing that I'll say, because I won't say it as well as Dan, is you know, I was very fortunate in the connections that I had, and to be able to build relationships up, to be informed and have my vision even heard by folks like Dan and Sandy and others. And, as CTIP continues to grow and we build a foundation on which an organization is able to support the infrastructures that have been discussed through the National Trauma Campaign and Press On and, CTIP Can and other educational work, the Building the Movement Workshop series, it needs to be informed by our advocates all over the country and people who are experiencing the way that systems impact them and promote stress and adversity, as well as the positive side, where sometimes systems do a very good job of reducing stress and adversity and improving people's lives. And having that inform our efforts is very, very critical. And as we continue to build the organization that can support that and develop partnerships like with NPSC, PACES Connection, and others, as well as at the state level with coalitions and organizations working at the state level and at the local level, your involvement, your voice is so important to us as we continue to create a vision. You can see our comprehensive vision on our website, which I can put in the chat as well, which is just the beginning process. But continuing to inform the work that we do and hearing, really listening to your experiences on the advocacy side, on the practice side, what policies you want to see. We won't be able to do everything at once, but creating avenues for folks to share, come together, and begin to have these discussions at a high level, at the local level, state level, and at the national level. And we really, really hope that someday it happens at the global level as well, is really, really critical. And so to finish this call, besides just thanking Dan again for being such a trooper and a champion and sharing his story, which is so incredible, to the folks that said that it should be a movie, 100% agree, have said since I met him that I think that Tom Hanks would play a great Dan Press. Hold up images side to side. I'm not a casting guy. I think that I'm like 100% right in that. So we'll work on that. But to end the call, we also wanted to, for those that are interested, have small breakout rooms for, 8 to 10 minutes probably. So that way in small groups, we're able to discuss, either how this presentation impacted you, don't want to neglect that part of the conversation, which can be very important, but then also sharing your vision for the work. And to finish this call, come back and just have a few examples of ways that you all see this work moving forward as well. Dan and I, with the platform that we have to get to share our vision, really want to turn that around and create, what I call microphone to megaphone, where we hear from all of you what your vision is as well. And so for those that remain on the call, I'm going to go ahead and open breakout rooms. When we come back, so in the breakout rooms, ask that everybody who wants to share has the opportunity to, to fairly share the airspace. But then also when we come back, for confidentiality to be preserved, people who shared, we don't want to call out people for having shared something that isn't necessarily our story to tell, but really reporting back on some of the learnings and some of the shared vision or unique aspects of a vision that come from these conversations. We know that these smaller group conversations where folks can share their vision is so important. And so I'm going to go ahead and open up these breakout rooms for all of you to share. If I'll be in the chat to let you know in terms of time. But again, how did this presentation impact you? And what are your visions for where the work should go moving forward? We'll bring everyone back in 8 to 10 minutes, and then we'll have the last 5 to 10 minutes of the call for there to be report outs. Really, really, really look forward to hearing all of your thoughts and ideas. And appreciate y'all sticking around with us so far. So opening up the breakout rooms now.
I didn't get asked to be in a breakout room, so that's
Are you
okay.
not asked? Hold on.
No, it's all right. I'm cool because I've
Should be
got a
room 3.
room 3. Okay, let's see. Ah, there we go. All right. Well, I guess I'll go away and come back. That was really good. It was not as snot slingy as I thought it was. Would have been. I think if we'd seen Dan's face, it would have been.
I would have, yeah.
That would have been. But I'm so glad he did that, and I hope to write it. So anyway,
So we'll get you the
thanks,
recording
Bob.
for that. Thanks, C.
Okay. Mhm.
Like Carrie just said, just for the recording, and then I can pause it actually. I could just pause the recording. That's my fault. Forgot about that. I'm really glad that Dan had a chance to share his story too. He's one of the most incredible people that I've ever had the privilege of meeting. And his heart for the work and his mind, and just the care that he genuinely has for the people that he's worked with over the course of his career is more than just inspiring. It's created a vision and an opportunity, I think, for what the world can look like as we work to heal and create sustainable and caring communities. From the work specifically with Native American tribes and reservations to really, create the, just some incredible outcomes, both on the litigation side and then, he alluded to it, I think, but he literally helped to form the largest lending institution to Native American tribes that still exists today. I think that he formed it back in like the 80s, not trying to age him at all. And it's still around and doing incredible work. And then for him to quote unquote retire, and, through health and, when he was healthy and well, and when he's not feeling as well, he commits to making the world a better place. Just because deep down in his heart and in his soul and in the core of his being, he believes that that's what the world needs. And with everything he's got, he's going to make sure that that happens. And I think that is a spirit that created CTIPP, because that exists for so many of our founders. Sandy, a woman, Susan Salison, who unfortunately is no longer with us, Andy Blanche, and so many others. That heart and soul of just genuinely, beyond just trauma-informed care, just genuinely caring and giving a darn about other people and working like heck to make sure that every community has what it needs and deserves, and that every family does, and that every individual does, and that all of society has what it needs to thrive is so noble and so necessary. And personally in the ED role, I see my job as working to really enhance funding and sustainability and infrastructure within not just the organization but the movement as a whole, so that way we can continue to promote this work. It's not right that this work is not valued in an economic sense, at least in our society. But we're going to continue to fight like heck to unleash resources to make sure that more and more is available, not just for us as an organization, but the entire organization only matters in so much as it supports those that are driving the work at the state and local level as well. Because again, in my experience, having worked in communities directly that are impacted by trauma, the reason that we called it lowering overdose and violence epidemics, which I didn't get into because I wanted to leave time, I wasn't supposed to talk that much. Probably went over trying to give Dan some breath, but the reason we called it lowering overdose and violence epidemics was that we just brought people together to have conversation. And the two big areas that were necessary is that there was high levels of violence especially gun violence, that had not been seen before by the community and was a sincere concern. And that there was high levels of overdose that were taking off, impacted by the opioid crisis, but also in the community that I was in, it historically, since like the 50s, has dealt with a methamphetamine crisis. And so there is historical trauma that was baked into the community, to the actual functioning of the community in an intergenerational way. And so the need to combat overdose and violence. And for both of those, like the way that the conversation sort of went was that, you know, we highlighted that those were the problems. And then I really worked to help to explain that trauma is a root cause of both, and that a trauma-informed approach can help to reduce or lower the both the overdose and substance use and substance dependence in the community, as well as issues around violence. And so that's why we called it LOVE, the Lowering Overdose and Violence Epidemics Initiative. But having more and more of the work driven in the community, driven by people with lived experience, people who have relationships with others, is so critical. Dan, I don't know that Cheyenne or Laura are on. If they are, then they've just been listening to me blabber to myself. But that was an awesome presentation. You feeling all right? You're muted if you're speaking.
I couldn't hear anybody in the breakout room. I don't know what the problem was.
Oh, that's not great.
No.
Okay. Yeah.
Anyway, I really appreciate the opportunity to tell my story. It feels wonderful.
Good. We should.
Good medicine.
People really loved it.
Mhm.
So I know that we talked about this when we were coming up with the idea, but maybe we can have a few more calls to go deeper, and we can record and publish it somewhere.
Okay.
If there are different aspects of things that you want to discuss further, let me know.
Okay, let me think about it.
Yeah, they don't have to be long either. They can be little 10-minute bites about specific subject areas, so that way it's not too exhausting.
Okay.
All right. You gonna be able to stick around for report outs, or?
Yeah, I'll listen. Right.
All right. Yeah, if you're too tired, put in a
Well,
heck of an effort. It's like MJ's flu game.
I'm sorry?
It's like MJ's flu game. You know, Michael Jordan played the game with the flu and dropped like 30 points.
Oh, yeah. Yeah.
Yeah. I mean, you just showed up when you needed to, and then, you know, it's awesome.
No, I'm more like, who was the guy, Wes Unseld? Showed up in the NBA Finals, hurt, but managed to carry the team. 1978, 77, 77 maybe.
That one I don't know.
Yeah, I know too. I'll take MJ.
But yeah, it was good. And then I spent a while. I remember you sharing that photo of you on the horse. It took me a while to find that, but I'm glad that
That
I
was
able to find it
wonderful.
at the time.
Yeah, that was great.
Good.
Yeah, I think that's one that I actually have a yoga mat on the back.
I think so, because you called it, like in the email, it says yoga on horses with Leo.
Right.
There
Yeah,
was, yeah.
we were trying to develop a yoga for cowboys video.
Was that why there was a camera?
Yeah.
That's awesome. Yeah. By the way, one person did say that, it was Steven. If Tom Hanks isn't available to play you, Brad Pitt would suffice as well. So
Okay.
that's
That
high
is,
compliments.
yeah. Yeah, I prefer Tom, but okay.
I do too.
Yeah.
Just closing the breakout rooms now.
Okay.
All right. So folks will start coming back in the next minute or so. Didn't stop the recording. We can either keep this. It was an informal chat. It was kind of nice for it to be like the informal chat side, like the like the first CTIP can calls.
Mhm.
Yeah. So it'll be nice to hear folks' ideas as they come back. I see 5 participants and no breakout room, so hopefully I didn't accidentally just kick everyone. Okay, folks are coming back.
Okay.
Wonderful. As folks come back, hope that it was a good conversation within the groups. Casey, were you able to hear everyone?
It was a great conversation and it ended too early.
James, that is the problem. I do that. I've got to not facilitate and be in charge of the
We were
breakout.
just getting into it.
I know. I am sorry. I will. First of all, Dan always tells me not to apologize, but I do feel like I owe everyone an apology because the breakout rooms always close too early. And so, for those who are just getting into the best parts and the meat of the conversation, truly do apologize. Not the intention at all, but we will continue to create and facilitate new opportunities for folks to be able to connect and have these valuable conversations. Because we recognize that. Dennis, go ahead.
Just need to learn to talk faster.
Me, everyone else, we just need more time together.
Yes, we love you too.
I love you all. I am curious to know sort of what some of the conversations were coming out of those breakout rooms, what some of the visions and ideas that all of you have are.
Okay. I was just because I came in late to the meeting, so I was just trying to catch up. But I like what I heard so far because you're bringing peers into it. Because I work a lot here in New York with peers because that's the up and coming thing, peer-to-peer work here. And I feel that I would be very interesting.
Absolutely. The peers.
Yeah, we had a meeting today. We were talking about mental health and homelessness, and somebody suggesting that they should bring peers into the homeless situation for more care and concern, whereas the counselors, with the paperwork and everything, they don't really have the time nor the energy for that. And I said, wow, that's a beautiful idea.
Yeah, thank you, James.
Mhm.
What are some other visions for where the work needs to go, or what successes people would like to see amplified that they discussed?
I think things are moving very well in all areas now, and it just needs to keep going.
Absolutely. That's why we call it building the movement.
Yeah.
It just needs to continue to build. What are some other folks' thoughts coming out of the conversations? Denny, you're on mute. I see you.
See my mouth moving. I'll just say from our group that there were some frustrations and concerns about some of the barriers that exist in localities that, where there's sort of a lack of infrastructure, but also like a lack of support and a lack of backbone agencies that can really coordinate these efforts. And in some cases, a politicization of trauma-informed whatever, some of it has to do with framing and understanding of what that means. And maybe it's become too cliche, I don't know. But sometimes these kinds of issues, are very much swayed by the political ties, particularly in conservative states. And so there's been sort of a lack of embrace, and people are feeling like, what do we do? What can we do as individuals or, as a coalition and, working together to really kind of better socialize what the value is of trauma-informed, and also how to do it. How do you get the adoption of these practices when some of these organizations and agencies just are really not motivated or not really understanding?
Absolutely. Those are really real barriers. Dennis, go ahead, please.
Yeah, I
got
had
them.
a very good meeting, Jeffrey and I. And the main thing we did was we shared our emails, because he's a person I'm trying to recruit for my to be involved with my elders blog on Paces Connection, which, by the way, you guys set me off to do. So you can blame yourself for that. And I also see another one of us. I see Janie McConaughey on here, and she's on part of that. And I'm built right here, right now. I'm building a network of seniors and PACES. So
Thanks, Dennis. And
That's
we
right.
will gladly take the blame for that, because we are so happy that you and the group are doing it. Godwin, I know that your hand was just up as well.
I just wanted to report from the group. I wasn't able to share because there were so intriguing conversations, but it dawned on me that there's a lot of people that are creating initiatives and working on things to promote trauma-informed and restorative, but I think that there's a lot to be heard. I think what you're doing here is something that maybe we should be asking that questions to the 50, 60 people about what their concerns are, what they want to launch, and maybe guide them to an initiative of some sort or some training that they might have. Because the things that I heard was where I was when I first started the trauma-informed movement. So we had some really great conversations, and Pat and Zella did wonderful in their concerns and what they're doing in their own city and town. So it was very intriguing, but I'm sorry I wasn't able to share.
Sounds like there were some great conversations and just not enough time to have them. And so we will be sure to do more of these sorts of brainstorm sessions amongst each other, and just opportunities to get to know each other. Even if we're across the country, I do think that knowing that there are other people engaged in this work similar to us can sort of reduce that isolation feeling that so many of us experience, especially in the communities like Denny was talking about. Adrian, I see your hand.
Yes, I think just to add to, I was in Denny's group, and just to add to that, we talked a little bit about kind of the importance of coalitions being a good mix of public and private partners. Like if they're too much public agency run, then it tends to move too slow. And if it's just private or nonprofit, they might not have the resources that state agencies have to kind of move it forward. And so I think there's a lot of opportunity to find neutral conveners within each state. I know there's been some good conversations Carrie and I have had about, the National Network of Public Health Institutes. So Carrie, I look forward to exploring that more with you next week. But they have, as I'm learning more about them, they have institutes, public health institutes within each state. And they can be a convener and help to braid some of those public and private funds, and then really fill the gaps for the coalitions. So if some of this public agencies can provide some of the basics for coalitions, then some of the the other private funding can really be focused on funding those gaps. And so anyway, there's a lot of opportunity there. Look forward to exploring that and reporting back when we know more. Thank you.
Thank you, Adrian, and Carrie, for the conversations that you're both having together. Are there any other, I realize that we're 5 minutes over time already. Are there any other, last comments, ideas that came out of the conversations that you want to share? If not, but you want to email something, please never hesitate to reach out with that following this conversation and on an ongoing basis. Hearing none, just want to again thank you all very much. Everyone on the call, especially those that have stuck around this long. Thank you for sharing your ideas and connecting with one another. It's so valuable. And just a big thank you to Dan for being a trooper through his presentation, and obviously sending healing vibes to him, and all of our best to all of you. So have a great. There's the man. Thanks, Dan. We love you. Everyone, be well. We look forward to seeing you in September. Take good care.